As our healthcare system faces an unprecedented crisis with the COVID-19 pandemic, providing safe patient care has never been more crucial. This includes ensuring handoff communication between exhausted, off-going clinical staff and their incoming colleagues is structured and concise. At the center of the methodology is a mnemonic, IPASS, which represents 5 key components: illness severity, patient summary, action list, situation awareness and contingency planning, and synthesis by receiver. The IPASS handoff methodology has been studied for over a decade, and its implementation has been associated with a large decrease in communication-related adverse events. The IPASS Patient Safety Institute has developed solutions to help hospitals implement this methodology in an effective and efficient manner. Though handoff communication should always occur verbally, a written handoff tool that is structured in the IPASS format to include these 5 elements should be used to align with the verbal process. Illness severity clearly identifies the patient being handed over as either stable, unstable, or a watcher. This tells the oncoming clinician the overall status of the patient relative to their condition. For COVID-19 patients, for example, you may indicate that a patient is unstable if they required a transfer to the ICU during the most recent shift. The patient summary section provides a summary statement or one-liner that contains key identifying information, clinical context, a concise description, and synthesized key elements of patient illness. It should also include a summary of events leading to admission and a brief summary of the hospital course. Additional information on the patient's care can be formatted in a problem or system-based assessment and should be adapted to your internal workflow. For all patients, you should indicate whether they have received a positive, negative, or unknown result for COVID-19 testing. Whether caring for a COVID-19 patient on the general floor or in the ICU, our written handoff template includes suggested pieces of information to convey as part of this summary. In an action list, the off-going clinician provides key action items that need to be accomplished during the next shift. This will specify actions to be completed during the shift which are distinct from the broader hospital plan and contingency plans. Several examples of potential action items that might be included for a patient with COVID-19 are shown in the written handoff tool on your screen. The situation awareness and contingency planning element allows the off-going clinician to highlight potential situations that may arise with the patient's care and how to address them. This provides the opportunity to develop and communicate solutions to problems before they happen. Clear contingency plans will help develop a shared mental model between the giver and receiver of potential problems that may occur and should be structured in an if-then format. If caring for a patient who cannot receive visitors, your situational awareness may include whether or not the patient's family needs to be updated and at what interval or based on what criteria. Synthesis by receiver is a verbal statement from the receiver that tells the giver the receiver has a clear understanding of the handoff. A good synthesis is not a restating of the handoff, but rather is a brief, condensed, and prioritized summary of the most important elements of the handoff. A good synthesis includes a brief summary of the action items and the contingency plans. In addition to providing care to patients with this novel coronavirus disease, many clinicians find themselves covering on a clinical service that is not their normal area of work. This lack of familiarity can lead to unclear expectations for information required at handoff in a new area. To be most effective in handoff communication with your colleagues, whether this is a new clinical service for you or for them, it is important to keep in mind several considerations. If you are giving the handoff, be patient, as your colleagues receiving handoff may ask questions. Ensuring you both have a clear understanding of the patient will help improve the safety of your handoff, so be on the lookout for cues indicating your receiver understands. Don't be afraid to ask for a synthesis at the end of your handoff to confirm that you and your receiver have a shared mental model about the patient's care. If you are receiving the handoff, double-check your understanding by synthesizing the handoff and asking questions. Remember to review contingency plans with your colleague to create a shared mental model on what actions might need to be taken in certain situations. This will help develop familiarity with the patient and the clinical area. While this guidance has been developed by expert clinicians in various care settings, the content within each mnemonic element should be adapted to reflect the needs of your unique unit, service, or care area. If you have any additional questions or would like to learn more about the IPASS handoff methodology, please contact us at info@ipassinstitute.com. An IPASS written handoff template can be found at the URL on your screen. And to all the essential workers on the front lines of this pandemic, thank you for all that you do.